students who have got a commitment. A lot of other schools will actually already from day one have students who are committed to becoming veterinarians. So there is a variation that as I go through Europe talking about this, I realise that I'll be talking to schools with different concepts on it. But as far as QA is concerned, if there needs to be a regular review of it, even though you are forced into taking by law a certain number in first year, there has to be a reflection on what you consider about this, what can you do about it, as well as on the allowing students to complete the program successfully, which is again very much student testable, the student exams. So that will vary. Those who are involved in the selection process, interesting, you can perhaps educate me. Is there, within the Spanish schools, is there a lot of decision making by the schools on who comes in? No? No. Really? So now where you are in a position, there are places like Belgium, etc., where you have to take a certain number, yeah. Well, in which case that particular final one doesn't really affect you. It would definitely affect those in France and some other, in the UK, Germany, where they do have adequate training must be provided in order for those who make that selection, which I think is only fair. So we'll move on. Standard 7, again, progression. Once you've got your students in, they will progress. Hopefully, they pass their exams. Whatever you have, sometimes you allow, I was talking to some colleagues here at Bitsons, how I think you have a system where students can be allowed to qualify even though they have failed a number, even a small number, of courses. This is quite difficult for a QA perspective, where we have basically day one competencies. Because in theory, you could say a student could qualify having failed, come back again, failed in the competence in pregnancy diagnosis in cows, for give an example. Now, a student might be failed in that by their teachers. That would be seen in many places as you are not fit to practice, and you'd have to repeat that until you pass it. You wouldn't have the choice. But as far as I understand it here, I may have got it wrong when I was talking over lunch, but you do have the ability, a student, to fail a certain number, I don't know what the number is, of exams and still pass. I can see from the QA point of view, you're going to have to explain that. The best way of explaining that is that that's not your decision. That decision is a national law, whatever you like. But I think you must come out and say that exactly, because it'll be picked up by the EasyVet visitors saying, do you mean to say someone can qualify from here and then go and work in France having failed this particular area? They're not day one competent in that particular, even though it's a small bit. You have to be very careful there, because from a QA point of view, that might be difficult to pass. But I think if you can show it isn't your decision, you might disagree with it. You can perhaps say, we do disagree with it. You can say that. We think this is wrong, but hey ho, it's the law of the land. But so, again, that's I think on progression, etc., the final one, you must be explicit on that. Students will, of course, fail. They will not be able to proceed as quickly as they wanted to, for many reasons, whether it's sickness or they're just not academically up to it or whatever. All of us will have students that fail. The establishment here, you must show from a QA point of view that you have mechanisms in place to identify these students that are not doing well and provide support to them. And remediation means that you can maybe give them extra courses or help in some way of teaching to try and get them up to the level that they can pass whatever assessment they are doing. And that, as I says in brackets, they're including termination. There will be a situation where a student, you just have to terminate them. They just will have to go. They may make their own decision, and if they do, is there any law that says they can come back in 10 years' time and still pass? Or is there a limit? I can see QA coming into that, and we have to set out the parameters of what it is. If students who are asked to leave, can they come back on it? And if they could come back, is there a time limit to when they could? And that would be seen as a quality assurance mechanism for progression of students. Students will often disagree, as we all do, with a particular decision. Usually a decision to do with exams. Right, it might be admissions, maybe exclusion, you've asked them to leave, doesn't matter. QA says there must be in place a transparent, in other words, everyone can see it, publicly available, everyone can read it almost outside the university, so especially parents of students, that's really important, that that is available if they want. And what is the appeal mechanism on it? Everyone will have different appeal mechanisms. So your QA process has to put these through A, B, C, D. This is our mechanism. No one is asking you to change your mechanism. We have a much better appeal mechanism than you. No. The QA is that you do have an appeal mechanism that fits in for you. Also an important QA, you can see why this section is important in QA, also important is that you must have something in place, the school must have, students can convey their needs and wants, so they can complain, they can make suggestions, they can, I'm sure they probably do have there, they can make notes, not notes, they can mark the particular course, they can give a judgment on a particular course and a judgment on a particular lecturer. Yeah, fine. So if that's all in place, do you have it in place? How can the students give their reflection on individuals and courses, both positively and negatively? And once they've done it, how do you handle it? Yes, so let me just go back one. So once they've actually done it, the QA will say, well, once you've got that information, what do you do with it? Who analyzes it? And how is it organized in terms of having an effect on what the teaching is going to be? It is tough sometimes, and I'm sure our school is not alone in this, that there are some people who are not natural teachers, who find it very difficult to teach. I remember one school, not necessarily Bristol, but I did meet this individual who had been a teacher for many years of like poisonous plants and poisons, basically. Not something that is covered a lot nowadays. But this particular individual used to give, I think, 25 lectures on poisonous plants and things that poison animals. So in the curriculum review, he was asked to cut his 25 lectures to, I think he was given 4. Which seems probably, I don't know how many lectures you give on poisonous plants, but 4 is probably enough to get through the important ones. So I remember this students complained of this teacher who carried on giving his course. And at the end of his 4 lectures, he'd only got to C or D, and then he stopped. That was his argument, that it was very important, but that again has got to be a poor teacher, and was certainly reported by the students, assessed, and it's a difficult one, isn't it? Because this is quite a senior person. But the dean and the school has to have a structure in which they can take notice of it. No one is asking a school to make a decision like that, but the QA is asking the school on your easy vet visit that do you have a system that the students can convey what they felt? And the mechanism is there. So this is really what that is. And it can be anonymous. Student establishment must allow students to offer suggestions, comments and complaints regarding compliance with the standards we've talked about. Students they're much more knowledgeable now, and they will complain. Students here are better, no different than students in the UK or France or anywhere else, especially if they're paying. That course was not good enough. And you have to have a system from QA that you do listen to them, and there is a way of dealing with them. And again, in your SDR, but certainly in your base room, in your annex, you need to show data that this has happened and there have been actions taken following the student input. And finally, feedback to the students. In a way, I've sort of jumped into this one because it comes into student progression and welfare, doesn't it? But there is a different standard. Standard 8 is where the experts will look specifically at exams, student assessment on it. They'll be looking at the different mechanisms you have of assessing students. But from a QA point of view, they are saying, well, in that exam situation, do you have a process to review the outcomes? In other words, how students got there. Maybe one program where they all failed 1 year. What do you then do about it? You must have a process in place to review the assessment outcomes and if necessary, then change it. That's all that's needed. No one is arguing and putting up arguments on a visitation that you must have more MCQs or you must have more written exams. They're not assessing that. For a QA point of view, they're assessing that you respond to changes in the outcomes that you've set yourself. I don't know if you have logbooks here. Many schools will have logbooks. What do I mean? I mean there's literally a book with all the different day one competencies and things written in it, and students are asked to sort of tick off they've done it, and often signed by a veterinarian that they have actually succeeded in that. A lot of schools do that. And I've seen a few nodding heads here, so I'm assuming that some, if not all, the schools in Spain and Portugal will actually have a similar system. Fine. Okay, good. If you do that, QA does come into quality control with what I would call logbook, for want of a better word. That they are going to ask, they're not going to say you haven't got how to spay a tortoise in there, They say, how do you spay a tortoise? I've got no idea. But they're saying, they're not asking that you are missing out on a skill. That's not the point. The point is for QA that whatever the skills are, that what have you got to show that the logbooks have been fully completed by each student. A student could just keep their logbook, but do they hand them in at the end to show that everything is signed in? What do they do? If they don't, and they just put it in their cupboard, then that is not exactly QA. So if you do use logbooks, then you must have a system in place for actually assessing that that logbook has been fully utilised by each student. Right, we're getting close to the end of standards. Academic and support staff. Again, I did sort of touch on that this morning. This is the training, not only of new members of staff coming on in. Is there a course? I think if there is no course provided or no mentoring provided for new staff, then that may be seen as a deficiency. Not too sure if it'll be a major deficiency as we move on, but it'll certainly be a deficiency. Depending at the level, it could be just a strong suggestion from the easy vet visitors. So there needs to be training. More difficult is what happens after that. How are staff kept up to date? Do they have any thoughts on after a few years they have to go back to another course? Or a lot of it is just on continuing education, showing evidence that they have been to courses. I think, as I said this morning, in the UK, as a veterinarian, in order to be registered every year, I have to show proof that I have done some continuing education, and my colleagues have to do the same thing. So I don't know what the situation is here, but that, again, would help in terms of a QA in this one for training. So we've got e-learning resources, biosecurity, and procedures. So I think it's all important that your members of staff are fully aware, and I would guess that's up to the Dean to make sure before your visitation here in a few months' time that your students, that your staff certainly know how to spell QA, if nothing else. That they do need to seriously know what QA is all about, and I guess you must be already doing this where all staff are made aware of what the Easy Vet visitation and the Uppsala SOP is all about, and how QA now is written into it. So it's going to be very important that all staff are fully aware of it. And this will happen because the visitors will meet junior staff, support staff, students, stakeholders independently. There won't be any senior members of the faculty at these meetings, and I can tell you they will question that quite deeply to find out exactly what they know, what they don't know, and what do they feel about it. So you have to make sure that your staff are fully aware of what is going on with the Uppsala SOP and QA procedures. So for QA with the staff, again, I think this is especially important on the clinics. It's really important that our young graduates, our young clinicians, should work towards their, as they go through their intern residency programs, go towards a full boarded exams. So this is not only the clinics, of course, the pathologists as well have their own well-defined mechanism. And of course, there are the European boards for a lot of the different specialities, including public health. So for QA, what is the school doing to help its staff reach that level of professional development? What are they doing? What help do they give? Both financial, time off, what help do they do? And support staff is more difficult. But if you do help your support staff, which could be at the sort of management level and the secretarial level, might be your animal handling, your sort of vet nurse level, whatever level that is of support staff, if you do any sort of development of their professional development with a small p, and then please put it into your SCR, because that would be seen as a very positive move on QA in terms of support staff. Another variation amongst universities in Europe is formal appraisal. Some places have an appraisal almost every year or every few years where a member of staff is appraised by his or her senior in terms, and they will set goals about what you want to achieve until the next appraisal. In theory, it's quite a good idea. It's not essential, but if you do any sort of form of appraisal, I would make sure that you do put that into your SCR, and with evidence of what happens from a QA perspective, how do you actually measure that that is successful? I think if you don't have any sort of formal appraisal or mentoring, I don't think that would be a major deficiency, and I'm speaking at a personal level here, but I think it might well be a very strong suggestion that the school does develop such a mechanism. Standard 10, you only have to read the Uppsala SOP to see that QA does not define into this at all. But there is no question it's a really important standard during an Easy Vet visitation, where they'll be looking at the number of publications at a reasonably high level in the school. They'll be dividing that into staff members, working out how many publications are being made. They'll be looking at the amount of income coming in. These are facts that you obviously put into your standard 10 in your SCR. But from a QA point of view, it's not immediately obvious how you're looking for QA in that one. I must admit. But, oh, I've gone back. I think and this hasn't really been tested yet either. I think with Standard 10, people are going to have to, we've always looked at Standard 10, but how is that affected on a QA process? Because you can't really measure it, can you? You could measure the amount of publications, but publications in what journal? Do you just look at clinical journals, which may have a low impact factor? Do you look at, Nature and Science and all these other things, the high impact factor? It's a very tricky one, I think, to get a QA measurement. To me, it's much more important as a standard 10, as a standard that we are looking for our veterinary schools to show that they do have a real level of research, an atmosphere of research. They're really encouraging research and PhDs in their institute, in their establishment, without actually saying that it has to be a QA measurement. So I put it in, but I can't see that the QA expert is going to be saying that this lacks QA. I think that would be quite difficult one to argue in Standard 10. But I can see how it might be brought up as a major problem in a school just if they don't have any research on it. Is that a modern veterinary school nowadays? They don't have a decent amount of research and pushing ahead on whatever their particular expertise is? I doubt it. Now, Standard 11 is literally a summation of everything we've been talking about and discussed previously. And it's a direct copy with, as you say, the word changed, establishment changed, but it's a direct copy of the ESG 2015. And this final paragraph is something that Pierre is very keen on and asked me to put in. He says that this is really important, Standard 11, to convince veterinary schools that EasyVet does not want a QA level higher than what is requested by ENQA, or in Pierre's phrase, no less, no more. So I think what he means by that is that as long as you meet reasonably the requirements of ENQA, on what their Standard 11, and that, as long as you reach that reasonably, then that is good. You don't have to be any more, but there would be a problem if you were a lot less. So anyone who knows Pierre can almost imagine Pierre saying that. No less, no more. Very much a Pierre phrase. He thinks, and I think he's right, that one of the reasons why this is going to help is to basically to actually reduce some of the difficulties we've had that I did mention to you with stage 2 valuations in the past. Now we've done this integration, I think it's going to be much easier to try and assess QA now within the standards rather than that totally separate QA we had in stage 2. Before we leave Standard 11 though, there is some other thoughts on it. And this is more thoughts for the future in a way. There will be national QA accreditation boards, and we've discussed this with Spain already, and we discussed this on Tuesday with the French accreditation processes. They don't have it quite as strict. I think you have accreditation bodies a bit like we have in the UK. And I would love to see personally that if we can develop EasyVet evaluation sufficiently, the national accreditation bodies may say, okay, that's good. We're not going to come and accredit you. We will depend on the EasyVet accreditation every 7 years in order to accredit the school. And that will, of course, save you.
Why not the opposite? Why not?
Because the opposite will be that the national accreditation body will not be just doing veterinary schools. They'll be accrediting engineering schools, they'll be accrediting...
So what?
Because, well, how many of those accreditation bodies with engineering are going to be able to accredit use in the standard of animals and animal resources? Do you expect them to do it? do you really expect a national accreditation body to understand the importance of animal handling? And I think there are specific things to do with veterinary schools that it would be difficult for a national. They can do a very broad brush, but I think they'd find it difficult to do very specifically on it. And I think we are asking very specific questions when it comes to some of those standards, which is to do with resources that are needed for the learning outcomes for teaching veterinarians. My view. Anyway, but nevertheless, whatever happens, you obviously would disagree with me, but well, interestingly, why would you disagree with me?
Because our national agency might be of the level that you want to say, but it's a national board, official national board, which is not the EAV. The EAV is a private institution, so it could be a little bit, how to say, matter of discussion.
Yep.
How official is the accreditation of a private association towards the national accreditation of an official board?
I can see your point, because it is, you're right. It is, EVE is a club of other veterinary schools.
That's right.
Yes, it is. Like, no
It
question.
is very much the thought I perceive here, even though nobody says.
What, sorry?
It is very much the thought, which is
What thought?
the thought is a private club.
Oh, yeah.
Even though we do not say, we very much of ourselves think about that.
It's interesting, yeah. There are ways around that. The ways around that other people do is to, I think when we were in Utrecht recently, what they do is that the national board they sent, I think, 1 or 2 individuals on the accreditation week. That's one way of doing it, is to have it. Another way of doing it is to have a totally separate procedure, which I guess is what you're doing here. On it is what we would do in the UK. We would have a separate accreditation process on it. Yeah, but I really think there are areas where some nations do not have a well-developed national accreditation policy that you might have developed here in Spain. And I won't mention names, but I can think of some nations within the EU that do not have a relatively well-organised, well-disciplined QA national agency.
Then, in such cases, let's do the process by the EAV.
Yeah,
But
which is what happens.
On the other hand, if we have a national board,
Yeah.
they should work together to develop a common process and not 2 different processes that we have to follow.
Yeah.
Because it's time consuming and an effort that we're not really
I quite agree with you. I don't know what your process is for your national accreditation here. All I can do is that in the UK, our national accreditation for veterinary schools, which happens independently of EVE, is they have now worked it out so they can use the same SER, but even though they visit separately. But the trouble is that's also a board which is a licensing board. So as well as an accrediting board, it's a licensing board. And it's the same with AVMA. In other words, if a university fails a national accreditation, the veterinarians from that university can no longer get a license to practice veterinary science. That is different. I don't know if it's the same with you here.
Yeah.
Well, in which case then it has to be. It's yeah. No, I can understand that. I mean, you've got to understand though that it's an important role, but I can see how in Spain and rather like the UK, it might not be a role which at the moment is it. But you have to try and save both time and effort from the universities. So even if you had a similar SER, would help. So they could use the same SER, but it means that your standards, you would have to accept the fact that the standards for a veterinary school are different than the standards for an engineering school.
Absolutely.
You have to. You can't expect that. I mean, it seems to be obvious to me. So, but it could therefore give an idea of how you could